Welcome back to Petology. I'm your host, Blair Balastravich, and we're going to have a discussion about pet first aid. But first, let's introduce the panel we have right now. We have vet tech Kara Harder, we have veterinarian Corey Bartley, and we have co-host Antonio. Yay! That might not have been a real cheer, but we love him anyways. Okay, so all seriousness though, pet first aid is very important.
Yeah, absolutely. And there's a couple different layers of it. I mean, the first thing to recognize is not everything is life or death.
Okay.
There are different levels of emergencies, such as obviously being hit by a car, probably a pretty big deal. If you scale it back to maybe a dog has been out for a run and has stepped on a piece of glass and has cut their paw, still something that needs to be seen. Probably fairly urgent, but not to the same degree as being, say, hit by a car or run over by a tractor or something like that. So for me, the best advice that I can always give, number one, is don't panic. Take a minute to stop and look at the scenario and see what is going on here, how bad is it, what is the problem. Nobody is ever going to be able to be helpful in a situation if they're just running around in a blind panic.
Okay.
The second thing is, in a lot of these scenarios, if there is an animal that is hurt and that is in pain, it may not always be safe for a person to step in. If you do have a major incident where there is a dog that has been hit by a car, they could be extremely painful and they may be reacting. So you can't just run in and pick the animal up in every scenario.
Okay.
You can get hurt, somebody else can get hurt. So you have to find a way to safely take care of the situation so that nobody else is getting hurt. If you are in a scenario where it is something extremely bad, like an animal being hit by a car, the sooner that you can get to a veterinarian's office, the better, just because there's likely going to be a lot of stuff that needs to happen in a very short time span. While you are in the process of trying to get an animal to a vet, there are things that can be done. You really want to be looking for, are there signs of active bleeding? Is the dog breathing? Do they seem conscious? Are they responding to what you're doing? Is there a safe way to get them onto a blanket so that you can move them into a vehicle? You're assessing these sort of things one by one and trying to find solutions for each of them.
So for all that, to process all that information,
Yep.
keeping calm is
Yep.
key
Yep,
in that.
absolutely.
Because if you got to think of all that, I can't even remember it all right now.
Yep, yep.
And if I'm panicking, I definitely won't
Yep,
be able to
yep,
remember it
absolutely
when I need
so.
to.
Yeah, if you can get help, if you can have somebody to help you do these things, so much the better. The more hands that you have being able to assist, you're going to be able to take care of the problems more easily. So if you are able to get yourself mobilized, I mean, many pets, if they're in pain, just getting them onto a blanket where you can lift the blanket and get it into a vehicle, and you're trying to keep that animal from rolling around too much and hurting themselves, that's going to be very key. For an animal that you feel like is having excessive bleeding, if they can let you do it, getting pressure onto a wound is always important. If you feel like an animal is not conscious and not breathing, then we start getting into more difficult scenarios where we start thinking about, can we apply CPR,
Okay.
which you do what you can in the amount of time that you have while you're trying to get yourself to somewhere where the experts can take over.
So with the stuff you brought with you today,
Yeah.
we're going to use
Yeah.
this guy.
We'll call him Scruffy. Yeah.
This is Scruffy.
Yep.
He's a stuffy breed.
Yeah, he's a border collie.
He's
yeah.
okay. He's a border collie.
Yeah.
He's not real, just so you know. So no pets were harmed and cured in making of the segment. But let's show me exactly what. Let's create a scenario. What happened to Scruffy?
Okay, so say Scruffy has suddenly fallen over and we're not sure what's wrong with him. I mean, the first step is to go in and first
Stay
step
calm,
is
stay calm.
stay calm, don't panic, see if you can find some help. I mean, the first steps are basically our ABCs are basically, does it seem like he is able to breathe on his own? Is there air moving back and forth? Does it look like he's breathing without any difficulty? Does it seem like there's something obstructing his airway? If there is there some way where we can get whatever is obstructing his airway out? Say, for instance, if there is a ball, is there a safe way to get in, pull the ball out, make sure he's breathing? And if we find that there's no obstructions and we're still not breathing, then we kind of need to assess, okay, is there somebody around, or can I get in here and help this dog breathe in the meantime while we're getting to a clinic? Looking up under a dog's gums or up under their lip to look at their gums is always a good idea because you can look and see, does it look like we have a nice healthy pink color to their gums, or does it look like we're turning blue, or does it look like we're turning white? Pink
Well,
is
that
a
makes
good
sense
color.
because like where would you see that on a human? You can see clearly.
If
Obviously.
you look on Baxter, you can see.
Yeah, she's nice and
see
pink right now.
Baxter's nice
Yeah.
and pink in
Yeah.
her mouth. Yeah.
Yeah.
Would you
So-
see anything in the eyes even?
Not necessarily. With dogs, you're probably not going to get a lot of color there. The gums are always the first go-to so that you can see what color they are. So,
Oh, see, there we go.
Yeah.
Okay,
Oh,
so
yeah.
she's good.
Yeah,
Yeah,
absolutely.
she's
nice and healthy.
oxygenated.
Yeah, so.
Okay.
And you can see that she's breathing and she's moving air back and forth really easily. There's no sign of any distress, and you
And
can,
she looks happy.
Yeah,
which
exactly.
it's a good sign.
and you can hear the air moving back and forth.
Of
You can
course.
hear her breathing, so you know that she is, versus a dog that isn't.
So scruffy situation. What's scruffy
Yeah,
situation?
scruffy situation. So say we have gone into cardiac arrest and we're not breathing.
Okay.
That is a big ticket item. So you really do need to get yourself mobilized and get down to a vet. But in the meantime, you can do, there is such a thing as mouth to mouth on dogs where you're basically trying to make a seal around their mouth.
Okay.
You're putting your mouth over top of their nose and you're giving them breaths.
Okay.
And you want to make sure that you're probably giving them at least 10 breaths in a minute. Somebody else should probably be starting chest compressions. Now, depending on the size of the dog, for a bigger dog like Scruffy, you can have them laying down and you can be using both hands. You have to use a fair amount of pressure to give chest compressions.
Okay.
But with a smaller dog, you're not going to be doing that because you could end up crushing them.
Of
So
course,
you would
yeah,
only
yeah.
just be using one hand like this, and you'd be doing chest compressions like that.
Okay.
Thankfully, most scenarios are not that dire. Most of the time, we're seeing things where a dog has cut themselves, or they have gotten themselves caught on something.
Okay.
So in those scenarios, again, you want to get yourself down to a clinic where somebody can help you. But there are things that you can do, and there are things that you can have at home that can help you in those scenarios. Or even if you're not close to a clinic, something that buys you a little bit of time. So, for instance, Scruffy has a cut on his leg that is bleeding. Well, the first thing you want to do is take a minute, see how bad is the bleeding.
Okay.
Can I safely apply pressure to the wound, and is Scruffy going to tolerate that? And if so, you can certainly get in, apply some pressure, get a little bit of a bandage on. You're applying a little bit of pressure with the bandage. If you don't have a bandage, I mean, even just getting in with a clean hand and pressing on that area so that you're putting some pressure so that we're not having a lot of bleeding.
And you don't want to have it, like you want pressure, but you don't want it too tight,
Nope,
right?
yeah, you can see how I'm just laying the bandage on the foot like this, and I'm not cinching it up. There's a big difference between having a bandage that is just covering the area and applying light pressure versus something where I'm cinching it so tight like this that I'm cutting off circulation. That's not healthy.
That's
so,
not good.
Yeah, so
Okay.
there is too much of a good thing. So in smaller wounds, sometimes just having at home a little bit of a nice antiseptic soap to wash an area and keep
Okay.
it clean. It's never a bad thing to have a little bit of polysporin around. It's
Okay.
not going to be a long-term solution, but it at least applies a little bit of a cover over the area, and it is an antibacterial type of ointment, so it's going
Sorry,
to
I have
keep
a
things
que-
from...
will any of those actually sting or bother the dog if you're applying it?
Good
Like,
question.
will it cause a little bit of discomfort at
No,
all?
like none of the things that we're doing in themselves will sting, but if you have a dog that has a big open wound, that wound is already sore to begin with, right?
True.
And so if you're putting pressure on a big cut or a big open wound, it's already tender. Pressing on it is probably going to hurt a little bit. So most dogs are pretty tolerant of that. Their dogs are people pleasers to begin with, and they're not really going to react too much, depending on the dog. Obviously, there are some dogs that will react and will not tolerate that kind of pressure, and then you have to fall back on the second rule, where it's you have to be able to do something, but you have to be able to do it safely.
Do they know? Do they know that you're helping? I'm asking you
I
to get
don't
inside
think
the
so.
psyche of a dog.
No.
Of
I'll
course
tell
you
you
can't
right
do
now,
that.
no.
But like you said, that's why I asked, because
Yeah.
like what it seems like,
Yeah.
you know, when it seems like they're trying to go, yeah, okay, help me. Do they understand, or are
No.
they just trying to?
I think most dogs are just confused. Yeah,
Okay.
And
they're
in pain.
confused. Yeah,
And
and
they're
they're
just
in
like,
pain.
help.
So yeah,
And a sign of pain can be aggression too.
Yeah.
Whether
Okay.
you're their owner or not,
yeah,
they will try
absolutely,
to bite.
where they're trying to react in that way. So, you know, again, yeah, you do what you can, but if the dog is not tolerating your assistance, then the best thing you can do is just get into a car and get down to the nearest clinic, and then the staff at the clinic can kind of kick in, and if the dog is not tolerating any handling, then we can jump in with a little bit of sedation or something.
So, what are some of the clear signs that your dog is hurt? Because I sometimes dogs are so great in the way that they are very relaxed in a lot of ways, and they can't talk to us,
Yeah,
which
yeah.
of course is probably the struggle with both of your jobs, is they can't say,
Yeah.
hey, you know what, my knee's really hurting. If you could do something, that'd be great.
Yeah.
What are the signs? I don't know how you guys know that. Talk about that.
Yeah, dogs are pretty stoic, so it's not always going to be in your face.
Just gonna set Scruffy
Yeah,
down.
absolutely. So some dogs will cry, they will whine, they will vocalize to let you know that they're uncomfortable. They certainly, if they have a particular appendage that is affected, they're going to limp and they're not going to want to put weight on that leg.
Okay.
Sometimes they will lick at that area repeatedly or even bite at it because they know that it's bothering them. And they're trying to do something themselves, and what they're doing isn't working, but it's all they know how to do.
Panting
Yeah.
sometimes. You have to watch that because it can mean a bunch of different things. Like Baxter's panting right now, but she's probably just a bit warm. But panting can be a sign of pain too.
Really?
Yeah.
Yeah,
Oh.
absolutely. Withdrawing, pulling away from people because they just don't want you coming near them because they're uncomfortable, and that's how they're letting you know.
Not eating.
Yeah, low grade pain, sort of if it's sort of not super obvious like a giant big wound, but sort of that low grade chronic pain, yeah, the animals will stop eating.
So it's paying attention to almost like day-to-day activities.
Yeah.
Really, you really need to know what's going on
Yeah.
And
with
you have to
your
know
dog.
your dog very well,
Exactly,
yeah.
right?
Yeah,
Like,
yeah.
you can't just go, oh, that's weird.
Yeah,
Like,
it's not always in your face.
Yeah.
So, yeah. I think in general, I mean, if you're in a position to be able to have things at home around, having a little bit of bandaging material, polysporin is great. Just having some clean gloves so that if there is something like a wound or say, has your animal stepped on a thorn, or is there something that's sort of sticking out of them, or even something as simple as having if your animal's been stung by a wasp or a bee, and is the wasp still in there, or is there a tick that's biting on your pet? I mean, you want, sometimes it's great to have a pair of gloves so you can get in there and do things and you're not making the area dirtier. You've got your gloves on to keep yourself clean and not to sort of make anything worse on the pet too.
Is there anything that you should avoid maybe putting on your pet if they get hurt? Like maybe there's something I'll put on myself that I think is a great idea to put on my pet if they're hurt, maybe got a scratch. What are some things that maybe I should avoid that I should not?
There's tons of things, honestly. There's I mean, people often think of using stuff like, I've heard of people using rubbing alcohol because, yeah, it has antiseptic properties, but it will burn and it will really be painful for the dog. So you never put anything like that on an open wound. A lot of times even people think of things like hydrogen peroxide, but that's not necessarily beneficial to an open wound, especially if the wound is contaminated. You could end up driving some of that contamination further into the wound. Something like that really needs to be assessed. I mean, I could think of
There's
dozens
so
of
many,
things.
and I'm sure. there's probably ways for people to get educated, and of course, ask your vet. Obviously, like
absolutely.
you guys know it, but the best bet you could do. Oh, a little bit of fluff there. The best thing you can do for you is to ask your vet and get all that information that you possibly need. There's so much, I'm sure, to talk about this, and this is a lot. But thank you for giving us that little bit of a peek as to what you can do if your dog is going through some issues. And right now, we actually are going to move over to our mailbag where we're talking about email. People are talking about their issues. This is an email from Rebecca about her cat.
Wow.
Now, it says, we can't fully see it, but I believe it says, how can you tell if a cat is obese, and what can I do to help him lose weight?
Okay, so
That cat is obese.
Yeah, that cat is obese.
That cat almost doesn't have legs.
Yeah, sometimes it's really simple. I mean, if your cat looks like a furry bowling ball with tiny little legs, then your cat is obese.
And we laugh,
yeah.
but it's not good
actually
for
not-
the
yeah,
it's not good for the cat.
A lot of
Yeah,
people would find that cute and endearing, the Garfield look of the fat cat, but it's not funny. Like, it is very unhealthy, and they're more prone to diabetes and
heart disease,
living a lot
just like humans in
shorter.
the same way.
joint problems,
arthritis.
And it's not always that obvious. I mean, certainly, but some of the things that we're looking for are if you're rubbing your hands along the sides of your pet, are you able to actually feel their ribs, or do you feel like there's a big solid fat cushion between your fingers and the cat's rib cage? Or same thing if you're running your hands along their back. If you're pressing, you should be able to at least feel that there is a backbone there. And if you can't feel it, probably the fat cushion there is too big.
So give me a list of 3 things that you should do. Do you lay off food?
Yeah, less treats.
Less treats, more exercise, I'm going to guess.
Yeah, and with cats it's challenging. I mean, you really have to stimulate them to want to move around, and you can't just sort of take a cat out on a leash every day. It doesn't always work that way, but I mean, bringing out the little laser or one of the little moving toys or
You
something
have to
like that.
trick them to exercise sometimes.
exactly.
If they love food so much, maybe put the food up on a different level so they have to jump up and down, or put some upstairs, some downstairs, so they have to do stairs.
So there's definitely some things you can do.
There's some things you can do.
We're going to check out, there's a video here I think we're going to take a look at. Look at Baxter, just working it. Just
Don't know what she's
adorable,
eating.
just relaxing,
Chewing on something.
eating a treat.
Yeah.
Now I think we're going to move on to a video. Do we have a video here? This is an amusing video that got sent in to us. The interesting thing about this is it happened over in China. It's a fad that started over in China, and it's dogs in pantyhose.
Wow.
Now, when you look at these photos, it's very unusual.
Yes.
Obviously, it's not something you see in your everyday
that one has
world.
boots
That one
on.
even has Uggs on.
Wow.
They're not just Uggs, honey. Or not just boots. They're Uggs.
They're Uggs, I
right?
hope, yeah.
Now
Oh,
heels, I'm not
wow.
sure we have to add that.
Oh,
But
wow.
I'm going to ask you guys, why do you think that they put pantyhose on their dogs?
For the
Okay, for the sake of time, I'm going to tell you what it is. It's to draw, so there's not as much shedding. Because that's like when they sit on the couches and that kind of stuff. That's the position they would sit in. So with the pantyhose, apparently it's a craze in North America that's catching on. I have not seen it. I probably won't do it to my dog because I don't think Darla would really appreciate putting pantyhose on. I feel like it's enough of. I've never put pantyhose on, but I feel like it's probably not easy to put them on a dog.
Yeah.
One thing we do want to talk about, of course, is there's this fish right here. We have a fish, and this fish has no name. The Fish with No Name sounds like an old folk song. We had a contest on Twitter to come up with a name for the fish. So we have, I'm going to let you guys, you guys have to decide between the two names, okay?
no.
So we got one from 4-year-old Isabel says the fish's name is Isabel.
Okay,
Right?
well,
See? And then we have almost 2-year-old Alex that says Guina because it's green.
Aw.
So, what do you guys think? That's the vote. There's 4 of us here.
putting us a 4-year-old against a 2-year-old.
Yeah.
I'm gonna go with
I know.
Guina because it's very unique,
Guina
That
is very
and
unique.
I like it.
All right.
Okay.
And
What's your vote,
Isabel is kind of, we're leaning towards it's a female. We don't know that. Yeah, I like, is it Greena or Guina?
Guino.
I think it's, because it's
Gui-
green, so
Guido?
I'm going to say Guina. So,
I like that. I like that.
What do you-
It's unique.
Guina?
Yeah, I'm going with it. Yeah, it's unusual. So I like anything that's just very unique. So
Okay.
Sorry,
well,
Isabel.
yeah, sorry, Isabel.
Sorry, Isabel. You're adorable as well.
Yep.
But 2-year-old Alex says Guina is the name of our Petology pet. Now, if you guys have any ideas or have any questions for our expert panel, you can send your questions to createtv@shaw.ca. We have lots of things coming your way in the next episode, so please stay tuned for Petology in the future.